Welcome to the first of a few episodes that were recorded live in the conference halls of the American Glaucoma Society 21st Annual Meeting at Dana Point, California in March 2011. I'm Robert Schertzer, Clinical Associate Professor at the University of British Columbia, Department of Ophthalmology and Visual Sciences, and Director of the West Coast Glaucoma Center in Vancouver, British Columbia. And we're talking about glaucoma with my guest, Josh Ehrlich from the Weill Cornell Medical College in New York State. In this episode, number 15, for late March 2011, we discuss baseline corneal hysteresis and its relationship with the amount of IOP reduction in prostaglandin treatment. We're live on scene at the American Glaucoma Society annual meeting, and I'm talking today with Josh Ehrlich about a poster that he's prepared with very interesting research that is related to corneal hysteresis, and patients with differing corneal hysteresis seem to show a different pressure reduction when tested with prostaglandin. And if you could just tell us more about that.
Sure, my pleasure. So the basic design of the study we have is a retrospective design where we looked back at the charts of 57 patients who were treatment naive and newly diagnosed with glaucoma. So they'd never been treated with prostaglandins, other drops, or any surgical therapy. And upon diagnosis, we tested them with the ORA, the Ocular Response Analyzer, which produces the corneal hysteresis value, which is thought to be a measure of the rigidity of the cornea. Additionally, we, of course, took a baseline intraocular pressure measurement at this time and collected basic demographic data. And what we looked at was whether this corneal hysteresis value at the time of diagnosis of glaucoma was associated with the reduction in intraocular pressure that patients experienced when begun on a prostaglandin analog. And we found that there actually was such a relationship. In fact, the approximately 15 patients that were in the lowest quartile of corneal hysteresis experienced a full 29% reduction in intraocular pressure after a mean follow-up of about 2.5 months. However, patients in the highest corneal hysteresis quartile experienced only an 8% drop in IOP over this period of time. So we said to ourselves, does this exist, this finding, independent of baseline pressure? Because we wanted to be sure what we were experiencing wasn't simply a regression to the mean. And in fact, in a multivariable model, we found that baseline hysteresis did predict the amount of IOP reduction from prostaglandin therapy, independent of baseline IOP. So the implications of this study are actually quite a few implications to this study. And firstly, the obvious one is for a patient walking in your clinic, what we contend is that this may tell us something about what we can prognosticate, what we can expect in terms of a medication response for a newly diagnosed patient. Additionally, this may have implications for selecting patients for clinical trials of medications and surgical devices. Instead of necessarily selecting the patient in the highest quartile of hysteresis, who we can be confident with or have some degree of certainty that a washout period isn't going to cause them to progress and go blind over a short period of time. We can also, with some degree of certainty, say that this patient isn't going to have a great reduction in IOP, and so we're not really going to be able to show efficacy among that cohort or that sub-cohort. The reason for this finding isn't entirely clear, although we'd like to emphasize that this actually is somewhat similar to a finding that was reported in the ocular hypertension treatment study, which was that patients with thinner corneas actually had a greater response to intraocular pressure lowering drops. Pretty similar to our finding, and they, of course, suggested that perhaps this was a feature of differential penetration of the drops through the cornea. And a similar thing could be at work here.
How did you measure the intraocular pressure? If a lot of that, our measurement of intraocular pressure is related to corneal hysteresis, how is that controlled for with the way pressure was measured here?
So there's two things. Of course, intraocular pressure, I shouldn't say of course, we have some evidence that corneal hysteresis is correlated with intraocular pressure, a change in pressure causing a change in hysteresis, or perhaps vice versa. We actually found, on average, we saw an IOP change of about 3.2 millimeters of mercury, and hysteresis changed by about 0.5 millimeter of mercury over that same period. So you're entirely correct. What we did was two things to kind of control for this or take account of it. One was that the intraocular pressure measurement that we used was actually the Goldman correlated IOP measurement that's given by the ocular response analyzer. So rather than introducing two separate pieces of error, that belongs to the ocular response analyzer and that which we get from Goldman tonometry, we actually sort of limited it to one piece by just having one piece of instrumentation to make these measurements. The other thing we did is we controlled for baseline IOP. We adjusted for that in the final model. Any correlation that hysteresis has with the decrease in IOP over time is not dependent on that baseline IOP measurement.
Great. And one more question. Is it possible that this effect is only related to the use of prostaglandin? Have you tried this for any other medications?
So it is possible that it's certainly a possibility that this is only related to the use of prostaglandins, and we know that prostaglandins do affect the extracellular matrix and have some unique effects on the eye. That said, there's certainly a lot of room and a need to do similar studies looking at other drops, but also looking at surgical interventions, whether a similar thing happens with laser therapy or incisional surgery. And results on that should be forthcoming, and we're looking into that, and I think other groups may be working on similar things.
Great. Thanks so much, Josh, for talking.
My pleasure.
Well, that's our show for today. If you like this podcast, please subscribe via RSS feed for my wholelottarob.com blog, iTunes, or the iHandbook app for the iPhone or Android device. Follow me on Twitter, where I'm Rob Schertzer, and check out my office website at westcoastglaucoma.com. Feel free to drop me a line at podcast@iguy.org and to rate this series on iTunes. Please help detect and treat glaucoma by keeping yourself informed.